arthritis in my hands. I don't know if you can see my wacky hands. Anyway,
Okay.
all I have to do is put them under there like a nail dryer and then turn them over and, 2 minutes and they feel better. It's amazing.
I do a lot of, I was an art teacher for years. And so this is what I called my Bubba hand. It would carry the big pails of water for the kids, the kids to their tables. So I use this one to do all the heavy lifting. And so I have arthritis right in here. And I've had it documented and the doctor said there wasn't anything they could do. And so I treat my hand with the light and I'm able to do all the needlework that I had given up and I do a lot of things for church. And it just relieves the pain. And I used to not even be able to hold more than one dish in my hand. And since using the device, now I can hold pots and pans that I hadn't been able to do in a couple of years without a support sleeve on.
Okay, all right.
So it's improved my muscles and it's helped with the pain and the flexibility also.
Mm-hmm.
Getting the light. What stage was in? Sorry.
I have many problems, one of which is osteoarthritis in my right hip. And I was not able to walk very well because I couldn't extend my leg at all to make the first step. I saw a sports medicine doctor. He gave me the complimentary cortisone shot, which took not much of the inflammation down. And then I had PRP.
Two protein-rich plasma injections, which is sort of the latest state of the art, where they draw your own blood. Are you familiar with it, Tom?
Yeah, I've heard of. Yeah.
So they draw your own blood. They put it in the centrifuge. They spin it for 10 minutes, and it separates the cells from the plasma. Then they draw the plasma, and he used a ultrasound guided needle to deliver the plasma right into the hip joint.
Right.
And that is supposed to, it's undifferentiated cells that are there, and it's supposed to start like making cartilage if it's a joint like that, or whatever is deficient in it. And Ellen had 2 of those shots about 6 weeks apart, and they helped somewhat, but she still couldn't walk without, she walked very little, and when she did, it was with a walker.
Yeah. At the beginning, I had to walk into his office with a cane, and I was holding on to the wall so that I wouldn't fall. That helped somewhat, but it really wasn't that great. I started with physical therapy, thinking that we needed to build up my muscles again. And the physical therapist came in and she gave me all of these things. Your sartorius muscle is out of whack. It's got inflammation in it. There's iliotibial band syndrome that I have, and besides the arthritis in the hip. So she did what she could for me, but it really wasn't very good. We took a break in the summer, and I found Lou's light, and that's why
I found your light, and I brought it. I said, Ellen, we're going to try this and see, how this helps you.
Within days, my leg that I was working on had absolutely no inflammation in it at all. I've not seen my leg look like that in a very long time.
I wish we had taken before and after pictures of even her leg, the size of it, the swelling. It's reduced by 25%. And that's why I had to buy my second unit, because I couldn't get my first one back.
I wonder who stole it.
I'm never getting it back. I have too many things I'm working on.
That's right. Oh, I've got the second from my office. Now I'm going to get a third. So, and then I'll get a fourth. I'll probably you should make me a distributor, your ovens. Once they try it, they get, I haven't had anything that I've done it on that has not had positive results. There has to be something that doesn't work on. I just don't know what it is.
have you seen results for osteoarthritis in the hip? I would like not just to take the pain away, but to heal the hip so I don't need surgery. Which product would you recommend to heal my hip? Actually, a very good question. And yes, with different forms of diseases like osteoarthritis, it's possible to not only reduce the inflammation, and when you reduce the inflammation, you can help reduce the pain. That's one. But now you can promote healing in the area. So it's very much a wellness aspect to do everything possible. Now, you need to also complement that, Terry, with good health as well. And you know, I know we all like our things to eat, but it's also very important that you look at whatever you can do on the area of your eating habits to try and improve what you put into the body will also help. But for sure, we've had the light can reach the area of the hip and help that. And so we had one individual that had arthritis in both knees, and they told the only thing that could help her and was going to be surgery in both knees. And she was able to totally avoid all surgery. And when she first came in, she was walking with a walker and having difficulty getting around and extreme pain trying to go in and out of a chair. And she used the light daily. And in about 6 months' time, she was able to walk around without a walker and without that pain. So it's possible to help put the healing mechanisms in, help the healing mechanisms in your body to start working on those areas and improving the quality of life.
I see another question. Does it help arthritis? And yes, they've just done a recent study, thing from WALT, the World Association of Photobiomodulation, and actually arthritis is one of the conditions that's actually shown to be very effective. In fact, I just did a talk last week, and I was actually talking in arthritis. So it was and it's extremely effective. Basically, arthritis through your whole body.